Hello everyone, welcome once again to our weekly conference. Today we are going to talk about health system in different countries, Brazil, India and Spain. We have three guests and they are going to socialize three case points. How is the service in private and public health offered in the countries? How is the care of children, youth, adults, and elderly? And the last one, what do government plans offer? Do you think that they are useful or not? First, we start with Luisa, who is from Brazil. Welcome, Luisa. How are you?
Yes, hello everyone. I'm Luisa and I am health administrator, so I work in a hospital. And today I'm going to share with you some important points related with health system that we have in Brazil. About the first question, here in Brazil we have a unique health system that works in all the country, but we have other compounds that help us to give a health opportunity to everybody. This SUS is public, universal, and free. We are integrated by Health Minister, Health Stable Health Secretaries, public and private hospital. It is important to say that every province have to be responsible with its issues related with health. According the second question that is related with people's attention, here in Brazil, health is a right for everybody in a state's duty. So it means that the health have to be offered in the best way. It doesn't matter if it's a boy, girl, child, young, or adult people. Government plans include basic assistance that have health promotion and prevention, disease prevention, diagnosis, treatment, rehabilitation, and health maintenance, and in some cases, urgent surgeries. In some cases, this system is really useful for people who don't have dependencies, but in the case that people that suffer from dependencies, it is really difficult to then access to that. They have to wait long lines or long months to get a medical appointment. So it is an aspect that Brazil health system have to change.
There was an important information, Luisa. Thank you so much for this. Okay, our next guest is Sandra. She is from India. Hi, Sandra. It's a pleasure having you here.
Hi everyone, my name is Sandra Herrera. I am from India. I live in New Delhi where I am the Ministry of Health. I would like to talk about three aspects. The first of these aspects is about the public and private health system from this country. I have to say that we are in a country where the right to health is very unequal. Access to it is limited and on many occasions precarious. Often it is influenced by the purchasing power of the family to which you belong and by the geographical area in which you live. Right? My work group and me are trying day by day to improve these aspects that are taken into account to give the healthcare to the people of this country, right? Because this is not correct that this service depends on these aspects. We have here some statistical data about this country. First, we have the total population, which is 1,240,000 people. The gross nationality income per capita in international dollars is that $3,590, and life expectancy at birth for men and women are for men are 64 years and for women are 67 years. Probably of dying before reaching 5 years of age per 1,000 live births are of 56, sorry, and the probability of dying between 15 and 16 years for men and women is 247, and for women, sorry, is 159 per 1,000 inhabitants. Total health expenditure for inhabitant is that 141. The total health expenditure as a percentage of GDP in 2011 was 3.9. The deficiencies of public health have grown payment models to the point that 63% of spending on medical service comes from the pocket of families, according to government data. The amount needed for a private consultation of health in this country can reach 11.5 euros, some that leaves out of any coverage the millions of Indians who live on less than 1.6 euros a day, right? It means that poor people probably doesn't have the opportunity to access to a private service of health because they don't have the no money. It is not possible that a person who doesn't have the sources could access to this kind of health system, right? About the care of people from the all of ages, I mean children, young, adults or relatives or elderly people. I have to say that India has a large healthcare the sector, and there are high quality medical service in major cities. However, in small towns and villages, it can be a problem to obtain adequate medical care, right? The main problems here in this country are the place where you live, right? The geographical area where you live, and your family, the position of your family, because if you don't have these good opportunities, you can access to a good health system. It doesn't matter the range of age. It depends only of these aspects that I mentioned before, right? About the third aspect, which is about the health plans of the country that the government offer to the people. It is good, right? These are very useful for people, for poor people, because they don't have the opportunity, as I said before. And for example, the Pradhan Mantri Jan Arogya Johana PMJAGY, is a program that gives 6,300 euros annually per family for the treatment of serious illness. It is one of the programs or one of the projects that the government have offered to the people to give them a better quality of life for all of the citizenship, right? For all of the people for this country. We are working, as I said before, by day to try to get a better health system to the people, because we know there are some conditions that are not good for people from India. Yes, we are working day by day, and it was all of that I wanted to share with you. Bye.
And the last one guest is Islay. She is from Spain. Hi Slay, how are you? Nice to meet you. Thanks for coming.
Hi everyone, my name is Islenis Perusa. I'm from Spain and my profession is journalist from Spain. So today we're going to talk about the health system of my country. So Spain public health system is free and universal. Consultations, access to emergencies or medicines are free. For this reason, the majority of people touch the public system. So the name is National Institute of Health Management. So each community is responsible for providing service through its health services. It's important to mention the private system. So in this case, the employed person contribute to Spain social security and at the same time joins a mutual. Mutual have their own network of hospitals, clinics, and laboratories. So access to healthcare is faster than in the case of the public system. Continuing with this topic, it's important always to mention the population of children and elderly people. In Spain, it's one of the countries that care most about the children and elderly people. So the Minister of Social System providing 4 million of euros for this population. So children in Spain are considered a big population group with a few health problems and needs, therefore making it almost invisible in service planning. So on the other hand, are many services related to obesity and in children's and mental problems. That is another important thing. Thinking about elderly people, Spain is the second one country in the world with longest life after Japan. So the population of people between 65 and 79 have chronic disease, for example, hypertension or maybe diabetes and also obesity. So shown up a upward trend. So another fact to take into consideration is the quality plan for the national health system. The main objective of the quality plan for the national health system is to respond to the challenges posed by the national health system in healthcare for citizens regardless of where they reside, and ensure that this care of the highest quality. It is structured in 6 larger areas of action. And the first one, the national health system is primarily oriented to the promotion of health and the prevention of disease. The second one, equally the third one, clinical resource, the planning of the development of human resource. In health, it is a key instrument to quality of care.
Thanks, girl, for your intervention. Thanks for coming and show how important is the health. Also, thanks for show how important is the investment of the government in the health. So thank you so much. See you and take care. Bye bye.